স্পাইন ডিফর্মেটিভ কনফারেন্স 4th চ্যাপ্টার হচ্ছে কলকাতাতে অপারেশন স্ট্রেট স্পাইন মিশন, মানে মেরুদণ্ড যাদের বেঁকে যাচ্ছে সেই মেরুদণ্ডকে দীর্ঘ সময় ধরে ধীরে ধীরে অপারেশন করে কঠিনতম অপারেশন করে পেশেন্টকে আবার তাকে সোজা হয়ে দাঁড়ানো এবং সুস্থ সোজা মেরুদণ্ড ফিরিয়ে দেওয়ার প্রচেষ্টা চলছে। আন্তর্জাতিক মানের এই অপারেশন এবং এই অপারেশন করতে এই হসপিটালে জিআইএমএসে বিভিন্ন দেশ থেকে বিভিন্ন সার্জনরা এসে উপস্থিত হয়েছেন। পুরো অপারেশনটা দায়িত্বে রয়েছেন প্রফেসর ডক্টর উজ্জ্বলকান্তি দেবনাথ এবং প্যালেস্টাইন থেকে সার্জন এসেছেন, ইটালি থেকে সার্জন এসেছেন, বিভিন্ন দেশ থেকে তারা এসে একটা টিম ওয়ার্ক করে এই ধরনের অপারেশন করছেন। তাহলে আমরা এই এপিসোডে বা ডক্টর প্রেসক্রিপশানের এই অধ্যায়গুলোতে আমরা এই ধরনের অপারেশন কিভাবে হয়, অপারেশন কখন করতে হবে, কি সিমটম দেখে অভিভাবকরা বুঝবেন যে তার সন্তানের এই ধরনের অপারেশন প্রয়োজন, তার রিস্ক ফ্যাক্টর এবং তার সাফল্যের হার সবটাই আমরা ডাক্তারবাবুদের কাছ থেকে জেনে নেব বিশদে।
As well as spine surgeon and a chairman for Operaon Straight Spine. What is Operaon Straight Spine? Operaon Straight Spine is a charity which helps with people or children, especially in the underprivileged section, to have their spinal deformity corrected at a very low cost and in a very charitable way. This charity arranges equipments, instruments and implants to carry out successful corrective surgery for scoliosis. You can see this correction of this deformity into a fully straight spine, and this is important to know that a lot of people come from abroad, especially surgeons, nurses and other theatre personals who do this annual surgical camp with us, and we correct a lot of patients. This year is the 17th OSS surgical workshop, and this will be held between 18th and 23rd of March in Jagannath Gupta Institute of Medical Sciences, where I am working as a professor of orthopedics. I welcome all the families, all the children of the state, rural, urban or semi-urban, to come forward and avail this opportunity to have their surgery for spinal deformity in a charitable manner.
আমাদের প্রতিনিধি শ্রমিক কথা বলেছিল উপস্থিত চিকিৎসকগণের সাথে।
My name is Emmanuel. I'm charge nurse in orthopedics theatre department in Norfolk Norwich Hospital, UK. I was originally came from Philippines, but for 23 years working in an orthopedics department. So first and foremost, thank you for having me here as part of the OSS Spine Deformity Program. And in answers to your question, obviously there's a lot of difference between the hospital environment here compared to the one in UK. I cannot say that one is inferior to the other, because obviously every community would rely on whatever resources they have, and they can just only act and practice to the resources that they will given to them. The most important part is the treatment and procedures still carried out in a manner in such a way that is intended by the surgeons, and the skills of the surgeons and nurses are very much part of it. And as I've witnessed for the past 5 days now, since since we arrived here last Monday, the skills of the junior doctors here are very much in line, obviously, to the consultants that's been teaching them. Same with the quality and standards of the nurses here. I mean, in true honesty, it can be improved, but that is only possible through further trainings and education, which part of my purpose here is to share what knowledge or an experience that I have
I am Professor Massimo Balsano. I'm come from Italy, northeast from Verona, University of Verona. Verona is located between Venice and Milano in the northeast part of Italy. I'm a professor of spinal pathology, head of regional spinal department in northeast Italy, seated in Verona. I have done more than 10,000 surgery for scoliosis, so deformity in my life. I started very young, when I was in a medical school in Padova, my original town. And now I'm very experienced in spine deformity surgery. So I'm here in Calcutta for endorse, for help, Professor Debnat, and we have a good team from UK, from Palestine, that is not known here, Professor Ahmed. And this is the third year I'm here for doing this program of school Operation Straight Spine. What means? We try to operate people that has deformity, scoliosis, and we straight the spine for the correction. And this is a universal technique that you use. And here in a rural country now is a good idea to develop, to grow this area, but they don't have any kind of support actually. So my idea is to have, we are an international faculty to support this project, to help people that don't have access to the normal health system, so they can have this operation that are very expensive for charity. So thank you.
And you are from, and what is the specialization and specific, and we know, our audience know the what.
I'm Charlotte El Labani, and I'm from the UK in a place called Norwich, which is in the east of England, and I work at hospital as I've got two roles, but one of my role is a paediatric scoliosis coordinator, and that involves basically being in clinic, meeting our patients within our scoliosis MDT, which is surgeons, paediatricians, myself, my colleague, physiotherapists, really a great MDT. We get people ready and safe for surgery. And with lots of preparation, preoperative assessments, anaesthetic assessments, many things we get involved with right up until their surgery, making sure they're safe for their surgery. And then we get involved with them after their surgery, reviewing them on the wards with the spinal consultants, ensuring that they have early mobilisation, adequate pain management, and they're up and about really quickly. And we hope that our patients go home within about 5 to 6 days following surgery, and then we see them in clinic afterwards as well, check their wounds, see how they're recovering, and we'll follow them up to at least a year, depending on their age. So the risks of scoliosis surgery, obviously it's on the spine, so it does carry a lot of risks, but we have things like infection, bleeding, a lot of the standard risks that come with surgery. But obviously the biggest risk, although very small, is the risk of paralysis when it comes to...
We are the layman in medical. We know that all nerves come and pass out from the spine.
From the spinal cord, yes.
We think this is a very big surgery.
Yes, it's very big surgery, yeah. It's very big. So
what is the percentage of cure of patient?
What with the being paraplegic, it's sort of about 1 in 600, which sounds a lot, but we do one surgery a week in the Norfolk and Norwich, so that's 1 every 5-6 years. So it's a very minimal risk, but there's always that risk when operating on the spine. You asked about whether they need more surgery. So the surgeries we operate on at the Norfolk and Norwich in the UK is we always operate on children that are around about 11 or 12. So there'll always be a fixed fusion. So in theory, they shouldn't need any further surgery. It should be Basically, the rods and the screws straighten the spine to a safe point. It's never perfect, but a safe point to where they are able to, the spine will eventually basically fuse, and the metal within about a year, and then that metalwork basically becomes redundant, but it stays in. It's very rare that you have to do another operation. Sometimes they might need to go a little bit longer, a little bit later, as in the metalwork needs to be extended, but it's not very common. So it's generally one operation on the children that are about 12 and above.
स्कोलियोसिस कंडीशन जो है वो ऐसा कंडीशन है जो स्पाइन और स्पाइनल स्केलेटन को स्ट्रेट होने के बजाय टेढ़ा कर देता है, रोटेट हो जाता है. सो दो तरह की चीज़ होता है, एक तो बेंड हो जाता है साइडवर्ड्स और एक रोटेशन. तो दोनों मिला के ये स्पाइनल कॉर्ड जो है अंदर और नर्व जो है उसके ऊपर दबाव डालना लग जाता है. और दूसरी चीज़ क्या होता है कि हमारे चेस्ट में और एब्डोमेन में इंटरनल ऑर्गन्स है, जैसे लंग्स है, एब्डोमेन है, लिवर है, इंटेस्टाइन है. तो ये कर्व जब बिकम्स बिगर एंड बिगर, जब बड़ा हो जाता है कर्व, तो लंग्स के ऊपर और हार्ट के ऊपर दबाव डालना पड़ता है. तो जब दबाव डालता है तो इसकी वजह से पेशेंट्स को सांस लेने में तकलीफ़ होता है, कभी कभी हार्ट का प्रॉब्लम हो जाता है, और कभी कभी क्योंकि एक लंग्स को पूरा दबाव डालेगा तो यू कैन लूज़ द फंक्शन ऑफ द लंग, तो इन्फेक्शन ज़्यादा हो जाता है. और ऐसे
तो पहले तो पोस्चर का प्रॉब्लम शुरू होता है.
नहीं, पोस्चर का नहीं, पहले ये जो स्कोलियोसिस कंडीशन है वो डिफरेंट रीजंस के लिए होता है. ओके, डिफरेंट रीजंस के लिए. पहले तो एक कंडीशन है जिसको हम लोग कंजेनाइटल कहते हैं, जो माने जो वर्टिब्रल बॉडी है, जो हड्डी है, वो ऐसे एक के ऊपर एक रहता है और सीधा रहता है, एक सिलेंडर की तरह. एक सिलेंडर के ऊपर एक सिलेंडर डालेंगे तो सीधा टावर बन जाएगा. लेकिन कुछ कंडीशंस में क्या होता है, वो सिलेंडर जो है वेज हो जाता है. आप समझिए कि एक सिलेंडर के ऊपर आप सिलेंडर नहीं रख रहे, एक वेज रख रहे, तो ऐसे वो क्या होता है, बॉडी ऐसे हो जाता है. तो दूसरी कंडीशन है कि एक न्यूरोमस्कुलर स्कोलियोसिस. वो अगर किसी को न्यूरोमस्कुलर प्रॉब्लम है, जैसे सेरेब्रल पॉल्जी है और एपिलेप्सी है, ऐसे बहुत सारे न्यूरोमस्कुलर कंडीशन जो मसल को अफेक्ट करता है, उसकी वजह से स्कोलियोसिस हो सकता है. क्योंकि मसल अगर आपके स्पाइन को ठीक तरह से रख नहीं सकता तो ऐसे हो जाता है, तो उसकी वजह से हो सकता है. और तीसरी है कि हमें पता नहीं है क्यों होता है, ये हमें पता नहीं है, उसको हम इडियोपैथिक कहते हैं. मेडिसिन में हम लोग इडियोपैथिक शब्द का तब इस्तेमाल करते हैं जब हमें एग्जैक्ट कॉजेशन या फिर एग्जैक्ट जानकारी नहीं है, लेकिन हमें पता है कि कुछ चीज़ें जो है वो उनमें, जैसे हर 10 स्कोलियोसिस पेशेंट्स में इडियोपैथिक का 9 पेशेंट्स लड़कियां होते हैं, वो हमें पता है.